Welcome to our channel, Life with Nurse Carol. We are still continuing with our endocrine system. This is our third part, and here we are going to cover the thyroid hormone. This is one of the most important hormones in our body because it's responsible for our metabolism. So like I said earlier in the previous slides, when you talk about the thyroid, think about metabolism. So again, my name is Mutes Caroline. I'm a licensed registered nurse. Subscribe, watch up to the end, share for those who are planning to take exams. For those that are lacking some knowledge in the management, you can watch this to help you out. So, the endocrine system, our thyroid hormones. We said the thyroid hormones are produced by the thyroid glands, and there are mainly two types of the thyroid hormone, but there are some other minor types. So mainly we'll be looking at the T3 and T4 because those have clinical effects. So the thyroid hormones are well known for controlling metabolism, growth, and many other bodily functions. As an endocrine gland, your thyroid makes and secretes the hormones. So our first thyroid hormone is the thyroxine, which is also known as the T4. So this is a primary hormone your thyroid makes and releases. Although your thyroid makes the most of this hormone, it doesn't have much of an effect on your metabolism. Once your thyroid releases T4 into your blood system, it's converted to T3 through the process of deiodination. So literally, while it's the highest concentration released, or the most common form of thyroid hormones released, it has the least potency. So the one that has the most potency is T3, even when it has the least concentration released. So looking at our second hormone produced, which is T3, or the triiodothyronine, your thyroid produces lesser amounts of T3 than T4, but it has much greater effect on your metabolism than the T4. The third hormone produced is reverse triiodothyronine, also known as RT3. Your thyroid makes very small amounts of RT3, which reverses the effect of T3. So RT3 and T3 have reverse effects. While the other increases your metabolism, this acts to reduce or to reverse the effects of T3. The fourth and last hormone produced by the thyroid gland is the calcitonin. This helps regulate the amount of calcium in your blood. So for your thyroid hormones to be made, your thyroid gland needs iodine, an element found in food, most commonly iodized salts. If you have too little or too much iodine in your body, it can affect the levels of hormones your thyroid makes and releases. So the thyroid gland, the anterior pituitary gland, and the hypothalamus comprise of a self-regulatory circuit called the hypothalamic pituitary thyroid axis. So a circuit, unless it's complete, it doesn't perform. So anytime it's broken, it will not perform as it should have performed in normal circumstances. So the hypothalamic pituitary thyroid axis helps us to regulate the amount of thyroid hormones and the effect of the thyroid hormones seen in the body. So on our right here, we see a diagram of the thyroid. So this is your neck. We said it's located in your anterior part of your neck, and here it has both the left and the right lobe, and it's just located above the trachea, just on top of that trachea, in front of that trachea anatomically. So let's look at the hypothalamic pituitary thyroid axis. When the hypothalamus detects low levels of the T4 and T3 in blood, it produces the thyroid-releasing hormone, or TRH. This thyroid-releasing hormone acts on the anterior pituitary gland to produce the thyroid-stimulating hormone. This in turn stimulates the thyroid gland to produce the T3 and the T4 into blood. So for our metabolism to keep in check, we have to maintain that hypothalamic pituitary thyroid axis. And in case there is something that goes off wrong, something will go wrong in the body. So how do we remember that diseases and the effects of the too much or the too little thyroid hormones when they are released in the body? So one, you should always remember that thyroid equals metabolism, and it's after metabolism that we get the energy. So if, for example, I'm experiencing low metabolism, it means I'll have less energy. I'll be dormant, I'll be docile, I'll be all forms of no energy. So what diseases do we get, or what conditions do we get when we don't have enough thyroid glands? One, we shall have hypothyroidism. Your thyroid is working less than normal. So in this case, we shall have hypometabolism, and this is also known as myxedema. It took me so much time to remember. Graves' disease, myxedema, are they for ADH? Are they for which hormone? So this memory lane made it very easy for me. When I see myxedema, I think of my ex didn't cause enough metabolism. So if I know metabolism equals to energy, and my ex didn't give me enough energy, it means he didn't give me enough metabolism, which means my thyroid, he didn't give me enough thyroid hormones. So that's how shortly I remember, vaguely, but it works for me. So myxedema, my ex didn't cause enough metabolism. And then when your body is secreting too much thyroid hormones, which is also known as hyperthyroidism or hypermetabolism, this is also known as Graves' disease. So how do we remember that? We said hyperthyroidism is equal to hypermetabolism. And if, for example, I'm always running, I'm always metabolizing, it seems like I'm in a constantly running motion, constantly metabolizing state. So at the end of it, I'll wear out without any more energy left. So I remember this by saying this metabolism will run me into the grave, because it's constantly on. I'm always metabolizing because I have too much thyroid hormone. So eventually it's going to kill me and take me to the grave, which gives me Graves' disease. So what are these diseases? The first one, the Graves' disease or hyperthyroidism. So in this case, what happens to the hypothalamic pituitary thyroid axis is that the body has too much T3 and T4 hormones but reduced levels of thyroid stimulating hormone. However, in normal cases, these should all increase depending, and if the TSH is increased, the T3 and T4 should also be increased. However, in Graves' disease, there is a breakdown of the negative loop. So the body is constantly making the T3 and T4. However, the thyroid stimulating hormone is reduced. So the hypothalamus senses the low levels of TSH, hence stimulates the anterior pituitary gland to produce that more TSH, which in turn causes further T3 and T4 hormone production. So we're already suffering with too much T3 and T4, but because the hypothalamus easily senses the reduced TSH, it feels maybe it needs to be stimulated more, the pituitary needs to be stimulated more to produce more TSH, which eventually has effects to produce more, and yet we are suffering with much. So here the negative feedback loop mechanism is completely broken. So with a high concentration of T3 and T4, we have excessive metabolism. And in the state which we call hypermetabolism or hyperthyroidism or Graves' disease, these are the signs and symptoms that you see. You have excessive sweating, you have goiter, you have tachycardia, you have heat intolerance, we have headaches, we have weight loss, nervousness, exophthalmos, muscle weakness, you have tremors, you have hypertension, sleep disorders, emotional stability. So literally your body is hyperactive. Your central nervous system is hyperactivated, your sleep cycle is disrupted, your cardiovascular system is hyperactivated, your emotional stability is destabilized. So everything is literally falling out of place. And because you're metabolizing more than necessary, you're burning up a lot of calories, burning up a lot of fats, you're burning up literally everything. So you lose the weight and you present with all these signs and symptoms that you see there. So how do we manage our patients and prevent them from running into the grave because of their hypermetabolism? One, we have the medical management, the anti-thyroid medication like methimazole. Anti means opposing, so we are opposing the effect of the thyroid hormones. We said we have too much. So methimazole stops the thyroid gland from making T3 and T4. Then the other management could be administration of iodide compounds, and these are usually used 10 to 14 days before thyroidectomy. Like I said in the previous slides, in the previous presentations, in endocrine disorders, one of the major interventions is removal of that gland. For example, if it's oversecreting, they can remove part of the gland, or they can remove all the gland if it's possible. So before they remove this thyroid, or before they remove some part of the thyroid, they'll have to give this patient some iodine compounds for 10 to 14 days, and this helps to reduce that size of the gland and also the vasculature of the thyroid glands, because we know that one of the highly vascularized glands in the body is the thyroid. So you give that so that you prevent post-surgical complications of bleeding. The other intervention is the radioactive iodine therapy, and this works by destroying the thyroid cells, which can cause hypothyroidism as a side effect, because you're destroying the cells that produce the thyroid gland. So you end up with the effects that we are trying to cause, which is the complication of most of the endocrine disorders. So what is our role? One, this person literally is falling apart. Every system is falling apart emotionally, physically, cardiovascularly. So the first and most important thing is you have to provide emotional support. Tell this patient what's going on in their bodies. Tell them this might take time, but it can be managed. It will be okay. Comfort these people. Be there for them in all ways. The other thing is, for patients undergoing radioactive therapy, as a nurse, you should isolate these patients for the first 24 hours and be very careful with their urine, or be protected while around them. They should be isolated because radiotherapy is not something that you should expose. Radioactive ions, they are not things you should expose for everyone. So they should be isolated for your or other people's protection. Also, postoperatively, after, for example, the thyroidectomy, you need to monitor this patient for airway obstruction and bleeding, because these are major complications after surgery. And also it's your role to keep a tracheostomy set on their bedside. In case of any emergency and their airway is obstructed, this can be used to intervene immediately to provide airway support. Next is my ex didn't cause enough metabolism. My eczema, hypothyroidism, hypometabolism. The thyroid gland is unable to secrete T3 and T4 irrespective of the high levels of TSH. The negative feedback loop is broken. Unlike Graves' disease where the TSH was low levels, here the TSH is in very high concentrations. However, the T3 and T4 are low. So what do we get when we are not able to produce the metabolizing hormones? So everything slows down. Like I said, metabolizing is activity, it's energy. So if we don't have that activity, if we don't have that energy, everything is slow. You find that these people weight gain because they are not using up any nutrients. They'll have a dry and coarse skin because even their absorption is slowed. They'll be tired and fatigued. They'll be constipated. They'll feel cold because they're not able to generate the heat the body needs. They'll have a dull personality. Even in class, they are very poor performers because they are slow. They have hypertension. Literally every system is shutting down, slowly shutting down. The GI is not functioning in a speedy way. Your heart is there. Everything is shutting down. So how do we manage hypothyroidism, hypometabolism, or what name is that? my ex didn't cause enough metabolism. How do we manage that? One is to replace the hormone. They need that hormone to activate their metabolism. So we'll give them a hormone called levothyroxine, and this should be taken on an empty stomach at the same time every day for the rest of their lives. It's for the rest of their lives. So advise them to take it on an empty stomach for easy absorption. Also, the precaution that you need to understand when giving this drug or when managing patients with hypothyroidism is never hold their thyroid hormone meds on the door of the surgery. Remember, literally, these people's systems are shutting down. And what happens during surgery is you sedate them, further shutting down the systems. So if you hold this, these people are at risk of not making it out of the operating room alive. So be careful when sedating them. Never hold their thyroid hormone medication. So again, thanks for watching. Life in Nurse Carol, we bring you content. It's summarized. It will help you with the management of your patient. It will give you a clue on how to pass your exams. So next we shall be watching and learning on the parathyroid hormone, which is responsible for your calcium regulation in your blood. Watch, like, share, and subscribe. Life with Nurse Carol. Love you all. Take care.